Welcome to another episode of the HealthCast. I'm super excited today to have Dr. Vishal Patel here as our guest. Thanks so much, Doc, for making time to meet with us. Can you take a moment to introduce yourself and your company?
Perfect. Thanks, Phil, and thanks for having me. My name's Dr. Patel, as Phil mentioned. I'm a primary care doctor based in Delaware. I'm boarded both in internal medicine and pediatrics, and I've been practicing medicine for over a decade now, post residency, and currently the founder and sort of chief physician for Healthy Path, which is really a relatively new company that's providing clinical care to individuals, not just in my area, but also on a national level, as I have licenses in multiple states. And the vision is pretty simple: try to provide care directly to the individual, try to avoid any of the extraneous things with insurance and other barriers, and ultimately help people at their prime. And I'm a huge believer of prime span and a lot of the new conversations in longevity and health span.
That's awesome. Yeah, I really like that too. I also work in primary care and really try to promote those as much as I can, those values to my patients. And one of the things that I try to promote that maybe I'm hearing with you is I try to get them on board. I try to have them take initiative and take accountability for their health. And, got to be engaged. So take me from being an ambitious young medical student to where you're at today. Like, just have a little career background for you.
So, born and raised in New York, and my dad was a primary care doctor. Actually, just recently retired. He essentially practiced as a solo primary care doctor in the inner city of Bronx for almost 40 years. He literally first job out of residency, graduated residency. I was born and he started his practice, and he was pretty much at that same place. Over 35,000 unique individuals. And recently, or in the last 5, 10 years, we always talk about population health as this term of providing both the clinical care and a lot of the social aspects of care. And he essentially pioneered population health, almost 4 decades ago, where he took care of the entire 10 block by 10 block community where he knew every single person, home visits, people came to him. At a very young age, I saw sort of what care looks like and the impact he was able to make to individuals. And I think that was probably the early signs of getting into career in medicine. And then I was fortunate to do one of these combined degree programs where I had the ability to get my undergraduate medical degree and my MBA all together. And that training sort of provided the backbone to not just clinical care delivery, but then also some of the other administrative and operational aspects of healthcare. And I think over the last 15 years between residency and in clinical practice, I've always gravitated towards how can we do a better job taking care of the individual, the community, recognizing that there's a lot of things that we can and can't control, but ultimately, how do we just improve human health? And wherever there have been opportunities, either from a digital standpoint, from a health equity standpoint, sort of quality performance improvement, I've always sort of jumped in addition to sort of clinical practice to really help challenge the status quo. And ultimately, if it was improving patient care, improving patient outcomes, I was always sort of raising my hand. And I think over the last, as mentioned, over the last 10, 15 years, I've had the unique privilege to work in various different arenas in healthcare, large health system, pharmaceutical company, digital health. And a lot of these experiences have really helped me better understand these levers of healthcare and understand how I can directly help not just an individual, but a community improve, because healthcare is complicated.
That's a super cool story. That's your dad's profession. That's uncommon, and to have almost like, I don't know if I'd say this in the Bronx, but just what I think of here is a small town doc that was just
Yep.
consistently showing up for people, and that's super cool. And then I just wanted, did you say you got an MBA and you're dual board certified physician in two different specialties and an MBA all at the same time?
Yeah. So it's, I stayed
You're a
busy,
workhorse.
and I think some of it was there's either you could be really deep in one area, and I've always been more of a generalist of like really trying to understand the broad spectrum of health. And I almost feel like I don't know, 90 to 95% of health issues that individuals have. I feel fairly confident to be able to just not only handle, but also be able to direct individuals to the right level of care.
Yeah.
And I think that that broad training really helps to understand, you need to go to the hospital or not? Do you need to see a specialist or not? Oh, can we just do watchful waiting? And I think being able to sort of see healthcare from different arenas has provided that sort of skill set for me.
Sure. Was there a transition point from highly trained young doc to various career role job, various jobs to where you're at now as as an entrepreneur and CEO and founder of Healthy Path? Was there something that led you there? Was there were you maybe frustrated with traditional medicine, or how did that plan out?
Yeah, I mean, I think not uncommon to what other colleagues of mine have mentioned is that, I think that in the traditional sort of system, there is always some barrier. So, number one, maybe health insurance. If I'm seeing a person and they want to either if the person is just like highly anxious about a certain condition or wants to know something, a test can sort of say, you have vitamin deficiency or not, or hormonal issue or whatever the cancer. And if that is not something that is contractually covered with their health insurance company, or it's only covered if a certain diagnosis is there, like it just became complex. And I don't know, maybe a few months ago, there was someone that wanted to get their vitamin D level checked and they had never gotten it checked. They were tired weeks. I used one of those as a diagnosis codes. And what ended up happening? It got denied. And then they got a bill for 90 to $100. There's a lot of, you know, patients frustrated. I'm frustrated. And it just doesn't lead to any sort of constructive or positive direction. And then you sort of find out like, oh, you can get that test for $5 to $10 if you just pay cash for it. So like there was just this disconnect that I was seeing. And then two, and probably more importantly, like I personally went through this like journey from a health standpoint for, maybe about 9, 10 months ago. I got blood work done. I was pre-diabetic. I feel like I'm relatively healthy. I'm vegetarian. I care about my health. Found out that I was pre-diabetic. My vitamin D levels, my vitamin B12 and iron levels were all very low. I had some gut issues. I had inflammation in my joints and I was having some tendonitis. And then I had like a rash on my face that wasn't going away. So I had all these health ailments, didn't really know who to go to. I asked a number of colleagues of mine. I
Mhm.
went to see a number of colleagues and I just didn't get the answers I wanted. And no one was able to sort of put the whole picture together. And that sort of started my whole journey of learning a little bit more about functional medicine, longevity, holistic, really putting all the pieces together. And then at the same time, recognizing that the traditional sort of system, and if I was going to that traditional setting to sort of get all of my ailments sort of addressed and sort of figure out the right direction to go in, that there had to be an alternative way to provide care to get me to not only be in my prime, but healthier and sort of on this path where I didn't have to take tons of medications and have all these stressors to sort of deal with from a health standpoint.
Let me see if I can say that back to you. So had some lab work, some standard lab work done, saw some things that were concerning, and then I also heard so took some initiative there, whether it's conversations with colleagues or doing some research, and then maybe also frustrated with hours and charting and so forth, and started to think about approaching medicine and patient care differently. That's
Yep.
what led
Yep.
to you developing your business. I've had those same emotions too. I've sometimes have commented with patients that I have a rapport with. I'm like, I don't like to do. I call it drive-through medicine. I don't like that. It's not how I want to be treated. It's not how I want to treat the patient. I want to give them full respect. And if I need some time to dive into something, I want to have that cushion. I don't want to be like, why are you here? Okay, here you go.
Yep.
Great, thanks. Bye. It's just not cool.
Yeah. Cause I think we can probably think of various scenarios where someone has to come in just because that's just sort of the how either reimbursements work or how we could sort of provide care, have to come in for instances where a lot of these things could be done via like a Zoom that we're doing right now, or can be done via text message. And then there are other times when you may need more time face to face with them. So it should be sort of what's needed for that condition or that sort of issue rather than dictated based on how you may get paid. So I think if you're able to sort of do it based on what makes the most sense for all parties, then I think that's how it should be.
Take us on a journey with Healthy Path, like when it was developed and how like how things are going.
So I pretty much had this vision this past summer and launched really in the last 2 to 3 months, right when the kids' school year started. And, to date, I'm working with a number of local employers, a financial company, a restaurant, a landscaping business, where the owners recognize that healthcare direct to their employees, that's rooted in evidence-based science, deep relationships, is critical for them to stay well now and into the future. So I'm essentially like a benefit that the employees get. And I've
Mhm.
been working with these employees by going on site, meeting them at their workplace. So, I was at the restaurant last week and saw a number of people that were cleaning the dishes, the wait staff, many of whom haven't sought healthcare in years, and were able to really dive deep and not just understanding their health concerns, but just understanding some of their like current lifestyle decisions and just providing them like one or two things that they may be able to do differently or just think differently sort of moving forward, and then get blood work, immunizations, and really start just taking good care of them. And then simultaneously there may be other employers that I'm working with where many of the individuals are already reading your books like Peter Attia's Outlive, and they already have a general framework of what they want to do, and they're 95% of the way there, but there could be this 5% that we may be able to tweak, and thinking about longevity levers and thinking about hot cold therapy or different training regimens. So it's been really cool kind of seeing the whole gamut, because there may be some individuals who are just starting their healthcare journey, others that are sort of along the path, others that, may be in that great healthcare. And by engaging with me and my team, we're able to sort of go from great to superhuman. And really, each person is on their kind of own journey. And, I'm a big believer that healthcare is not just local, but it's very personalized to individuals, so that,
Yeah.
each person isn't being compared to, their colleague or someone else.
I like that. That's cool, man. And that reminds me of some things that I share with my patients too. I joke with my friend. I try to promote the three things I try to keep it real simple for my
Yep.
patients. I try to talk about sleep, nutrition. I call it movement. Not everybody wants to
Yeah.
exercise. I like to exercise, but not every.
Yeah.
I joke with my friends. I say it's not like I'm trying to get my patients to bench press, buddy, but I
Yep.
just want them to move their body more.
Yep.
And so I sometimes even think about it in simple ways, just like, okay, cool. Like you don't want to go to the gym, no big deal. Can you just park further away in
Yep.
the supermarket? Can you just park on the other end or Walmart? Can you just like you don't have to park up close? Like just a little bit like sprinkle movement throughout your day. Walk your
Yep.
dog, stuff like that. And getting on, if they have parents, I ask them to sometimes get on the floor. If people have low back, atraumatic low back pain, I'm like, can we start if it's in their range, like can we move more? Can we start
Yep.
there?
Yeah. No, I think just with, I just launched this campaign earlier today where we're doing a fitness challenge, not even, or like a December challenge, pre New Year kind of challenge with one of the employers. There's about 15 employees there, where there's four things. I'm trying to keep it very simple: no alcohol for the day, and you get a point. Walk more than 8,000 steps. Don't eat after 8 o'clock. And I sort of said move. The exercise goal was either go to the gym, or if you don't end up going to the gym or have a workout, do 50 squats and 50 push-ups, some sort of like exercise sort of movement. And then you can get up to 4 points a day, and it essentially gamifies it. And
Yeah.
it's been helping me personally as well too, because at the end of the day, I'm like, I think yesterday I was like, oh, I'm at 7,500 steps. I would normally just sit there like watching Monday Night Football instead of
Yeah.
kind of just sitting on the couch. I just went on the treadmill, and and I walked, 1,000 or 1,500 steps before in the evening. So it was just one of those
Yeah.
where I'm just now I'm also being more intentional about things.
That's great. Talk to me about, so you serve patients in your, I want to say larger community, driving distance, whatever that means, but also nationwide. Like what does that look like?
Yes, right now, being the um obviously with the way licensures work, obviously to provide clinical care, you need to have licenses in different states. I think currently I have about 11 different licenses, and there are there's one of the organizations I work with has an office in Chicago. So they have a number of employees that work there. So through that, I've been able to meet not only some of the employees in Chicago that work for the company, and then through that, they've been able to connect me with other individuals and having sort of conversations with other employers in sort of different regions where we may be able to do this virtually. Once you sort of understand a specific region of where can you maybe get blood work done there, where can you get, body composition testing, is there a local GI or cardiac person to do things like colonoscopies and more advanced cardiac testing. So the vision is sort of like if you end up getting get a better understanding of a specific region where you may have a density of individuals, you have the ability to sort of take care of that region. And as things sort of progress, the model that I'm sort of liking this to is, I have my suit tailor. The guy lives in Thailand, and then he comes to America on a yearly basis, and he kind of makes his rounds across the country. So he'll come to either comes to your home or comes to a little like hotel in the area, and then may be there for 2 to 3 days. So that vision is that if you end up getting sort of a density of patients that you're taking care of, individuals or a company, maybe on a quarterly basis or twice a year basis, you may go there in person to sort of do your full in-person assessment, build rapport with the individual, and then the rest of the care is done virtually asynchronously. And it's kind of the best of both worlds. And, a lot of financial advisors and other industries are already doing that. And this is something that I think healthcare can learn from, and it could be sort of a win-win for all parties.
You were saying, though, let me go back a step. Something about your tailor comes from Thailand to adjust your suits or modify them as every
Yeah.
day or something?
Yes, there are a number of these companies, some of them Indian based, some of them in other Asian countries where all of the work is done abroad. And then essentially they don't have like a storefront here. So the way that they sell in America is direct to consumer. And they either
Yeah.
go to people's homes or go to, a local hotel where people sort of come and then get your measurements. You sort of figure out what you want to do. It's done abroad. Then they ship it
Yeah.
here. Who knows about all the
Yeah.
tariffs
Yeah.
and all this other stuff. But prior to
Yeah.
that, it's significantly cheaper and you get, pretty good quality.
I'm smiling because I'm wondering if some of either yourself or your patients either, I'm sure most people maybe have to let it out in the waist, and maybe some of yours are like, I need a little bigger in the arms and
Yep.
bigger in the shoulders, or a little tighter in the waist. Just that's what I'm smiling at.
Yeah, yeah. Like it's been like obviously I was going off tangent a little bit, but 10 years ago the suits were a lot longer, then they became shorter for men, and now it's becoming
Yeah.
longer. So it's like a ever evolving kind of industry.
Yeah. So is your ideal client, is it individuals or companies? Are you favoring now, like, 'cause I've heard a lot about this. In fact, the hospital I first worked for, I live in near the Four Corners, and I first worked for this hospital. I was amazed by this idea. This is like 15 years ago. Um, they just realized that healthier employees make happier, more efficient, more productive employees. So I was an RN at the time, and they just put everybody, I think everybody from, whatever your role is, through a basic health screening of everything from cardiovascular assessment, lab work, basic labs. It was just super cool. And I just thought that investment spoke a lot on the employer's behalf.
Yeah.
Is that your ideal client right there, as opposed to individuals walking to your office?
Yeah, I mean, I think right now I'm doing a combination of both. I think I'm a huge believer in like in the whole lifespan, health span, prime span, sort of longevity work of how do we help individuals sort of go from good to great, great to superhuman. I think those that sort of seek me out that are individuals are already kind of either on this journey already have the willpower, the mindset of like this is the direction they want to go. So it's a little bit easier kind of working with individuals who are already coming in engaged or at least somewhat engaged. I think
Yeah.
from the employer side of things, it's sort of, I've seen kind of the whole gamut as I was sort of alluding to like the different employers that I'm working with. Like you have some employees that are ultra health conscious, like every single person is like up to date with all their screenings and what have you. And then you have employees where they just don't go to the doctor, right? So I think it's where I feel like I could add the most value is I'm not going to be able to solve every person's drive to improve. That's there's a role for that, but I think personally, I'm favoring working with individuals who are already on this journey of improvement for themselves. Obviously, there are certain companies that this is kind of the DNA of the individuals that are there. So some combination of individuals and then companies that a lot of these individuals I work with would sort of work for would be the ideal client base. But at the same time, it is gratifying to sort of provide to certain individuals who either undocumented, don't have insurance. So I like right now, I kind of like this variety where, a few days a month, I'm seeing individuals where, you're really trying to get them to drink water instead of drinking 10 cups of coffee or 10 sodas, drink
Yeah.
8 sodas, right? And having those conversations because the improvement that they may be able to make, the delta of, what their current life expectancy is and potential life is dramatic. So I think from that standpoint, it is very gratifying. And, right now, as I'm sort of growing, I have the ability and flexibility to sort of play in both those areas. And been able to sort of tap into nurses and other sort of individuals to sort of join the team on both aspects to sort of essentially make this a team-based sport and be able to sort of have a greater impact.
That's cool. It sounds like you see a wide gamut of patients, everyone from super healthy people, maybe they're actively participating in sports as adults, perhaps, or exercising, to people just trying to make ends meet. People working in maybe a restaurant, I think you mentioned, or maybe other industries where things aren't that easy, and they're busy too. That's one thing I've had. Like, I have patients that are single moms with kids, and like, I mean, really going to ask them to go for a walk when they're already working two jobs? Like, come on.
Yep.
And so that's cool. That's interesting to have that gamut of trying to impact people in ways that you can, either small or larger. I get that.
Yeah. And
Um,
I think the other thing that I normally share with individuals is regardless of your drive or where you are from a socioeconomic standpoint or where you work, I've yet to meet a human being that does, if I say, do you want to be average? Majority of people will say no. Right. And then that's often a way that I may be able to engage individuals to say, if you want to be average, there's a chance that by the age of 50, you're going to be on multiple medications. By the age of 60, you're probably not going to be able to work and you're going to have, a couple more debilitating things. And then in your 70s, you're going to pass away. Right. And that's average. Right. And if you want to sort of change that to say you want to be above average, then you could start having the conversations of, having better biomarkers, having a better body composition, eating a little bit healthier, moving, sleep, like some of those things that we sort of talked about, identifying 2 or 3 levers that they can work on because it's hard to work on 10 things at once. Prioritize 2 or 3 things. The cool thing about this model of like frequent touch points, not having to sort of deal with traditional sort of have to come into the office, but you're able to use multiple ways to engage with individuals. You could sort of check in to see how things are going. And then the other cool thing is that a lot of these individuals, especially in the restaurant and a couple other places, like they have such a strong relationship with the owner, the managers, and
yeah.
they're oftentimes they're telling the managers certain things. The managers may share some of the information to me. So it's this kind of closed loop way where I'm able to kind of see how things are going even when I'm not there, and it's able to sort of impact their care and their health, hopefully in a positive direction at all times.
Yeah, yeah, yeah. Do you guys touch at all upon, I was gonna say stress, but maybe mental health is a better word. Sometimes I comment with my wife, who I mentioned was an NP. I'm
Yeah.
like, whether it's myself having a bad day or whether it's patients, I'm like, you can do all the organic broccoli you want, but if you're not, if you're poor sleep or if your cortisol's high or if you're just like, beating yourself up constantly or just burning the candle on both ends, like that's just not working
Yep.
out. Like, do you guys touch upon that?
Yeah. I mean, I think I was.
Yes, right. I mean, mental health is
It's
it's
a
hard to have a clear lab. I mean, there's some metrics, but
correct, correct. And it's a very qualitative thing. And I think for many years, the way I practice mental health would be I'm in the room for 3 to 4 minutes. I feel stressed, anxious, sort of being in the room because of the way that person's telling the story. And then I typically would prescribe Lexapro. I'd just talk about medications
sure.
and then bring in, either some sort of psychologist that I'm either working with, or say, go talk to someone. And then I think over the last few years, just going through my own kind of personal health journey, sort of seeing family members go through their own sort of health journeys, that was, in my opinion, sort of really impacted by the mental health aspect of it. Like, I've had just a greater fond appreciation around mental health, and the space that I currently have my practice, where I do things sort of in person, is with two local psychiatrists that I'm
Mm.
very cordial with. So I've just gained a deeper understanding on that front. And a lot of it is like, you're not going to solve it all. A lot of it is to really just try to drive a little deeper to sort of find the root cause of like what's their level of engagement, level of stress, and really just try to identify one or two things that they may be able to do, implement on a daily basis to, maybe bring it from a stress level of 80 to maybe 75, right? And
Yep.
really
Baby steps.
just take baby steps to get to a place where it's feasible. And I think the other is, it's very easy to sort of think like, oh, so and so has a great life because they got a big house, they drive a nice
Mhm.
car and all this other
We all
stuff.
do
And
that.
we look at social media, and that unfortunately fuels some of this anxiety. So I think just trying to tell people, say, like, focus on yourself, don't worry about others. There's some baby
Yeah.
steps you can do, breathing techniques. Earlier we were talking about, I was in a stressful environment. 2 weeks ago, I did a cold plunge, right? Cold plunge
Yeah.
obviously has a lot of health benefits, but it's not easy to like be in 40-degree water for, 2, 3, 4
40?
minutes. And that's where just basic like box breathing or 4-7-3, just different things to kind of get your mind off of things can be so powerful. And so these are just small things you can do on a daily basis. And it's great that we have so many tools, like, people have
Yeah.
Apple Watches and other sort of tools that they have that just tells them meditate for a few seconds or breathe for a few seconds. And all of that has just a profound effect, not just in the moment, which is what matters most to most people. But then if you're doing it consistently, you'll sort of see that your stress levels will slowly start to come down a little bit.
Like that. That's cool. Uh, let's talk about maybe some successes and some challenges that you've experienced with your company.
Yeah. So, I think the number one challenge is, with employers, you're starting to see healthcare costs are just constantly going up. The cost of business is just going up, and sort of going to them to say like, hey, you're already spending X percentage of your revenue on your expenses. Do you want to spend a little bit more by, paying for your employees? So I think that's been a challenge to say like, hey, this is just another expense, even, with inflation and all these other things. So that's um, something that I kind of knew going in. And I think one of the ways that I'm trying to sort of learn in this space and learn from others is, the ideal would be if an organization is paying, let's just say, $1 million for healthcare, can they continue to pay $1 million next year, but instead of paying all million to the health insurance company, pay, you know, 90%, 95%, and then the other amount to someone like myself, and to Healthy Path to sort of take care of them. And then also do that by, lowering hospital visits, all the metrics that
Yeah.
lower costs. So I think really trying to bundle in direct care services with one's insurance is sort of the name of the game, and a strategic way to not just lower costs, but then also provide great quality care. So that's, a challenge, but then a potential opportunity as well too. And then I would say the other challenge with individuals is very much the same. Like, hey, I work for a company, or I'm self employed. I pay money to health insurance. I'm just going to go see someone that takes health insurance. Oftentimes people will reach out and they'll say, like, oh, like, you don't take insurance. Like, let me get back to you in, 2 to 3 months. I'll give them recommendations of people to see. And then sometimes they'll come back to say, hey, I wasn't able to find anyone. And I think one of the things that I'm starting to implement and figure out is, once you sort of have a engagement with an individual, if they're not completely sold at that time of sort of having a concierge direct care provider, putting in sort of systems in place, i.e., kind of like a CRM, or some sort of tool to then sort of re-engage with the person a week, a month, or at some sort of cadence so that you're still, still building that relationship.
Mhm.
With any industry, even personally, a lot of times, like you'll look something on Amazon or some sort of service and you're like, oh, do I need that? Do I not need that? It's too expensive. And then, you may have to mull over that for, weeks or months to sort of make a decision. So like, how do I use that same understanding in other industries and sort of apply that to providing a clinical service?
Tell me something you're most proud of with as an entrepreneur.
I would say probably the thing that I'm most proud of is when I see individuals who, I think this has happened now 3 times in the past week. I talked to 3 different individuals that are all, one was a physician, one was a lawyer, one was like a financial executive, highly
Mhm.
educated in their, you know, 40s to 50s, have been on top of like healthcare for the most part their whole life, have, had some sort of relationship with healthcare. And all 3 of them said the 30 to 60 minutes that I spent with them, either in person or over Zoom, for creating a plan for them, going over their labs, ordering things that haven't been done. All of them said they learn more about healthcare themselves, their path in that short period of time than they did in the past 40 or 50 years. And it was just gratifying to see that this is making it like a lasting impact on them, and that they're like, oh wow, like now I can do these 2 or 3 things, and this is going to help me with my pain or with my mood, or and something that's just not going to help me like now but for the future. And it was just great to sort of hear from individuals that, in my opinion, were well respected individuals, professionals who have the knowledge, who have the access. But and I didn't go above and beyond. And it was just like
Yeah.
routine, in my opinion, it was just sort of routine care, but it was like regarded as like, oh my God, this is like the panacea of care delivery.
Yeah. That's cool, man. I think that speaks to your skill set. That's cool. Plus, it's also cool when you give people like even small action steps, actionable things to take on. Like, can leave the office and do just try this. Just try this and let me know. How does the future look for Healthy Path?
I mean, I think the future is really bright. I think there's a few things that are helping the tailwind. I think we're recognizing that healthcare costs are just going up in all facets, and the ability to kind of get direct care, to be able to be more proactive rather than reactive, like all of these things are really just going to help curb costs. And I think as premiums go up 20-30%, like the ability to sort of go to an employer to say like, hey, we have a proven tool, skill set, and ability to sort of lower your total costs, like I think that's just going to speak volumes for itself. There's more and more data that's sort of coming out in all types of employer groups, where by implementing sort of direct care with, maybe a high deductible or some other plan, can overall lower cost, improve, employee engagement, decrease absenteeism. So I think I'm like just very excited, for that space. And then I think we're seeing, regardless of where you are on the sort of political spectrum, I
Yeah.
think there's just a more of a conversation around health, around food as medicine, around getting crap out of like what we're eating day to day. And I think people are just more mindful of this. And it's just great to see. Like, I did a home visit last week. I went into a person's home, the husband and wife, neither of them are in healthcare. And literally on their kitchen table was Peter Attia's Outlive. And there were all these different notes that the person took around like blood tests and something. And again, some of this is very like dense information, and it's, individuals can't really do 30 things at once. But it was just great to sort of see that this type of information is now in the hands of individuals that, like, this is not what they do day in and day out, and are now starting to think differently. And then lastly, like, I just talked with 2 college students who are interested in going into healthcare, and they were like looking for shadowing opportunities and things like that. And I just had a casual conversation with 2 college kids, and I was just like, how's college these days? Like, are you guys partying a lot, drinking? Like, what's the vibe? And it's like no, like, that both of them, again, they could be like, don't really drink much, like, the exercise all the time, like the mindset of like the college student. And again, it has just drastically changed. So like, I'm just really excited for this next frontier where, I'm hoping in the next 2 to 3 decades, we're not going to say like currently like 6 in 10 adults have a chronic disease, or 7 in 10, right? So I'm very hopeful with a lot of these lifestyle changes that we'll be able to sort of bend that curve, and and maybe only 20% or 30% may have a chronic condition.
Yeah. Yeah, that's cool. I think that's what, and I think in one of our messages, you used the term medicine. I think you used medicine 3.0 and 4.0. And I think for me, I summarize that by like just having people more engaged with their health and showing more initiative. And I tiptoe on the I call it the political landscape in the patient room. I use it wherever side you're on. I use it. I touch upon health insurance. And I'm like, it's time to look out for yourself and your family. Like I'm not sure health insurance is looking out for us. Like let's look out for each other. Let's look out for you and yours kind of thing. And
Yeah.
people find that motivating and they jump on board with that. So I've had some traction with that one.
No, I think that's great. I mean, ultimately, we have to be a bit that whole model. Every single time you're on a plane, you got to put the mask on yourself before others. I mean, at
Yeah.
times we have to be selfish and just make sure you take care of yourself, because there's no one else. You're your best advocate. You know your own body, and we're only on this planet for a short period of time, and you really want to like maximize the time you're here. And I think going back to that whole prime span of like, hey, if you're in your 30s and 40s, like, how can we prolong that feeling that you have being well, feeling well in your 30s and 40s, in your fifth, sixth, seventh decade of life?
I really appreciate making time. This is an awesome talk. Where can the audience learn more about you and your services? Where should they go?
Yeah. You can hop on my website, healthypath.care. And then I'm on Instagram at Healthy Path Forward. So those are sort of two places where I'm starting to comment more. And then you can sort of find me on LinkedIn as well too. But I'm really hoping to start putting more content out both on the website along with my Instagram.
Well, Dr. Patel, thanks so much for making time to come on my show. And it was a pleasure to have you. Thank you so much.
Thank you again for having me, and have a blessed day.